You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our RazorCast studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Behzad Nazari. Dr. Nazari is the founder of Antoine Dental Care, a family dental practice with specialized dental services in Houston, Texas. He began his career as a registered pharmacist after graduating from Texas Southern University, and he then pursued dentistry and graduated with honors and a Doctor of Dental Surgery from the University of Texas at Houston. Dr. Nazari holds certificates in orthodontics, implant dentistry, and cosmetic dentistry. For over 15 years, Dr. Nazari has been serving generations, and he is widely considered to be one of the top dentists in the country, and he's also a contributing member of our national network of industry professionals. Today we're going to talk about a very important topic, gum reshaping. Hi, Dr. Nazari. How are you today?
I'm doing very good. How are you doing, ma'am?
I'm doing great, thank you. So my first question, why would someone consider getting gum reshaping surgery?
Overall, the majority of the cases regarding the gum reshaping surgery is cosmetic. Overall, the studies and also the surveys have shown that the pleasant smiles involve showing the full length of the front teeth plus a couple of millimeters, which is like about 1/10 of an inch of showing the gum. There are patients that the way they smile, they show too much of gum. And then it can be because of the skeletal reasons, or it can be because of what we call the hypermobile lip. It means that when they smile, the lip moves too much. So it can be like some simple surgeries on the lip, or the major surgery on the jawbone, or it can be just very simple orthodontic cases that we can correct those, or it can be just very minor surgery on the gum that will not be showing too much of the gum, would be just remove some of the gum around the neck of the tooth, so when the patient smiles, it will not be showing too much of the gum.
Okay, and what is involved in a gum reshaping surgical procedure?
Well, there are different techniques that can be done to do that. As I mentioned earlier, it can be a major surgery that can be done by plastic surgeons or by oral surgeons. They reposition the bone. Or it can be as simple as like a laser surgery that we have available. With laser, we can remove a couple of millimeters of the gum tissue, or we can use the old-fashioned blade scalpels. Every case is evaluated individually, and depending on the preference of the patient and also the doctor, that which would have the least complication for the patient, we decide to do that.
And what does gum reshaping surgery accomplish, and how do people see results right away?
The results is going to be, it's not going to immediately, like when you walk out of the chair, that you're going to see that immediately. It's going to take a couple of days, anywhere from a couple of days to like about 2 to 4 weeks of the healing process. In majority of the cases, you can see the results within a couple of days. The minor cases, especially if laser is used. When we remove the gum tissue, there is going to be some soreness. Then that patient, we're going to give him the postoperative instructions on what to eat and how to take care of the area. And in the major cases, probably there is going to be the healing process of about 2 weeks on average. And then they're going to come back for post-op evaluation, and basically from there they're going to see that they're going to see the results within 2 weeks in the major cases.
Okay, and how long is the recovery after a procedure? I know you just mentioned 3 days or so, but in general, how long is the full recovery?
In minor cases, again, it should not take more than a week of full recovery. If it is a major cases, probably up to about 4 weeks.
Okay, great. And are there any side effects to gum reshaping procedures that people need to be watchful for?
Depends on the case. In majority of the cases, there is no side effect, except the post-operative soreness or sometimes, very minor pain that we prescribe proper analgesics or painkillers to the patients and proper care using a soft toothbrush, nothing spicy, nothing too sour to eat, like the lemon juice or vinegar in their salad. And we give those post-op instructions to the patients. And there is no restrictions as far as, after the gum surgery, the healing process is completed. During those couple of weeks of postoperative care, we give the post-op instructions to the patients of what to eat and how to take care of it. And as far as the relapse, there isn't much of a relapse on majority of the cases if the patient follows the proper hygiene care at home.
Okay. Well, thank you so much, Dr. Nazari. We know you're really busy, and we just want to say thank you for your time and help today.
Thank you. Thank you for having me.
And for our listeners across the country, if you are interested in speaking with Dr. Behzad Nazari, you can either go online to www.antoinedentalcenter.com or call 713-364-8990 to schedule an appointment. And on behalf of our entire team at Razorcast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.